This is Dentistry Disrupted with Dr. Craig D. Clayton. I'm a wellness and biomimetic dentist, passionate change maker, social media thought leader, and educator on disrupting the way we approach oral healthcare. Come along with me as we journey towards a healthier and more empowered you. Before we jump into today's episode, I want to let you know that I am hosting a live class all about airway health in a few weeks. This will be a great class for anyone wondering if they or their child have airway issues, are early in their airway journey, and want to know how to get started. I love live classes and getting to meet my students. The Q&A at the end is my favorite part. There will be limited seats available, so please see the show notes to get on the wait list if you want to be there. Now, let's jump into today's episode. I'm excited to introduce my good friend, Dr. Neel Bulchandani, to the podcast. He is an integrative airway chiropractor, movement educator, and the creator of groundbreaking techniques like the soft method, integrative stomatognathic and embryology, a fusion approach that weaves together chiropractic care, craniosacral therapy, fascial work, visceral work, frequency therapy, and deep understanding of the body's developmental history. He is very excited to be in a phase of teaching his Floor of the Mouth protocol and is on tour this year in 2025 to teach it. Dr. Neel is often the provider people turn to when nothing else has worked. Practicing across California and now expanding through his Floor of the Mouth tour, which I am excited for him to talk more about. Dr. Neel is deeply collaborative, working alongside dentists, lactation consultants, midwives, ENTs, and many others to help children and adults resolve complex airway, feeding, and structural issues. He's also a husband, a father of three, a philosopher at heart, and someone who truly weeps and laughs with gratitude for the privilege of this work. And you're about to hear why. So I want to welcome to the show Dr. Neel Bulchandani.
Hey, thanks, Dr. Clayton. I appreciate you doing that and getting through all of that. Like, I threw some long words in there, so you guys would have a challenge, but you passed the test, so you did well.
Oh, good. I pronounced them appropriately.
Totally. Yep.
Okay.
You got 'em.
I was laughing as I listened to a message from Dr. Bulchandani about the pronunciation of Boise, the city where I live. And so, yeah, that made me laugh. But you got it. It's Boise instead of Boise, which most people don't know.
Well, that's an aha moment because I grew up my whole life, just thinking Boise, thinking like you were so articulate in your pronunciation that I'm like, what's going on here? I Googled it quickly and I'm like, oh, no wonder he was enunciating it and emphasizing it because that's right. I'm like, now that I know it's pronounced Boise, it's hard to say it any other way.
Yeah. Yeah, it's funny. There are a couple towns here in Idaho that you would think would be pronounced a different way. Well, there's a Moscow, but everybody calls it Moscow. Uh-huh. There's a McKay, Idaho, but everyone calls it Mackey. So anyways, kind of funny. But on to the good stuff. So Dr. Bulchandani, you have such a unique title, Integrative Airway Chiropractor and Stomatognathicologist. So can you break down what that means exactly? Because those are very unique titles that our listeners, especially the last one, may not have heard before. And many of our listeners may be brand new to this type of bodywork. So how did you discover this? What do these terms mean?
Well, I think that the integrative airway chiropractor is kind of like just a word to describe that, first of all, as a chiropractor, to come into the field that way was, I love it. And then I merged that with so many other disciplines of healing that I love and learned. But the integrative part is that it's not only do I feel the integrative part comes from merging different techniques, but I try to look at like what's going on with somebody, not just their physical body, but are there emotions at play? I mean, a lot of times there are. Are there traumas at play? And so how can we integrate when we're, looking at how we can journey through healing? That's kind of like the mind and body. How can we integrate and access healing because it's such a vital part? Airway, for sure. I love this opportunity to help people with their airway. It started, 9 years ago almost when my daughter was born. I'd already been a chiropractor for 8 years. she was born with a tongue tie, and like any parent who's struggling and seeing my wife, with the painful breastfeeding, I was like, what is going on? So there's so much to that story, but it's what threw me into the field, made me a student of this issue, the pain it was causing with breastfeeding and all the other things that it affected sleep and whatnot. And then I started to be a problem solver in it for our family, and then started to then see all my patients, and then with new eyes see them and their issues, and then started to look at that as okay. And so I would say integrative airway and feeding is sometimes when I use my really long title, because feeding, we start off this world with feeding milk. It's like, that's priority, right? It's like, yes, we need air, but we need that milk. So the feeding part is about that. I haven't really used the word integrative stomatognathologist as much, although I mention it whenever I teach and when I travel, and then I talk about beatboxing and how that was the only way I could get my daughter to settle because she was so stressed out from her tongue tie and all of that. Even though we did
beatboxing? Yeah,
beatboxing was the only thing that settled her nervous system. I was I would sing to her, and she's a singer, so that helped sometimes. I would to make some sounds like shh, or even like now with little babies, if I'm working on them and they won't settle, I'll go and that helps, or but then you go to right, just that's my amateur beatboxing, but it got really good at that time because the loud percussive sounds will still a unsettled nervous system, and so she would just go like and she would finally be able to sleep and fall. So I don't know how many naps I got her into by beatboxing, and we laugh about amazing. That now. So yeah, so stomatognathologist is the body, the jaw, how everything is connected. There's research articles out there on it, and it belongs to the field of dentistry as a term. And then I've just kind of been sprinkling it back in there, saying, how can we bring back this deep understanding that the tongue, the jaw, the head, and the whole body, vision is connected to it, and hearing is connected to it. And so stomatognathoology is like, I just like the way it sounds, and I think I'm excited to bring it back.
That is great. In the introduction, I talked about Floor of the Mouth tour, and you are visiting Phoenix and Boise, and what was the third state?
Chicago.
Right now, Chicago. Yeah. So what made you first realize that the floor of the mouth is such a powerful area for influencing the entire body? Because I know talking with you when I had the privilege of going out to dinner with you a couple weeks ago, a lot of the techniques that you used, you've developed just via intuition and have built a very, very unique approach. So yeah, tell us more about the floor of the mouth and why it's such a powerful area.
Yeah. Well, I mean, the floor of the mouth is like, I say somebody else that's in the field too. We were talking about it, and she was, had her phrase, and I'm like, yeah, the floor is the door to more. The floor of the mouth is the door to accessing more of the potential, not only of like the ability for the tongue to move away from it really easily. We got to give credit to all the myofunctional therapists who are rocking out, like Nicole Cantello here at Santa Barbara Myo. That's the office I work out of, and collaborate with so many amazing myos in the field. They're always trying to get that tongue to dissociate from the floor of the mouth. And of course we can say like when there's a tongue tie, that's a lot harder. But second to that, literally next to that, are these compensatory muscles that are there on the floor of the mouth, the orofacial, the mylohyoid muscles. So, I mean, when I first started out, like I had no idea I was going to be delving into this stuff at all until my daughter was born with a tongue tie. And then it started out as, all right, so, we had an amazing release from a great pediatric dentist, Dr. Shervin Yazdi in the Bay Area, amazing guy and amazing, provider. And that helped night and day, but I still needed to do like every 4 hours. I scheduled breaks between my patients for the next, 6 weeks so I could do the post-op stretches. So I could do those. And at that time, that was like the protocol that we were running with. And I felt like it was really good. So I would do those, 30-second to a minute stretches under the tongue and the lip and the cheeks to make sure there was, optimal movement and lack of reattachment. So that was great. But you know what I noticed is I'm like, that wasn't really helping them stay loose. I'm like, I keep redoing it and it's not easy for her. So I started to spend a little more time investigating the floor of the mouth because naturally that's where we were able to get movement now because of the removal of that tongue tie. And I started to see, why does this area carry so much tension versus that, and left versus right, and back versus front? And then I started to work on all the organs that I found in her. And later, as I looked through all the, kind of with all the patients that I saw from babies to adults, and I created the data for this, and then I started looking over, like there's like 70 areas in the body that I find can be connected to floor of mouth tension when there is a tongue tie, a narrow palate, jaw formation issues, any of those things that all happen at 4 or 5 weeks in utero. Well, so I started releasing the lower esophageal valve, just loosening up that area, loosening up the tummy, if we want to say it that way. But for body workers out there or parents who know this stuff, you're going to loosen up the ileocecal valve of the colon or release the diaphragm tension or the right kidney, and I would work on these areas, and then I would find, whoa, that floor of mouth tension decreased radically. And then those post-op stretches were so much easier because for me, I'm like, as a parent, I'm like, I want to make this as easy on her as possible, my daughter. And then for any patient, I'm like, whoa, if that's so tense and uncomfortable, something's going on here. But it feels like, for me, it's linear in that those areas of the body I started to connect, because that's my floor of the mouth work. People are like, is it just about the floor of the mouth? I'm like, no, the floor is the door to more. The floor is the beginning, and then we look everywhere. And there was even this girl that I saw in the Bay Area last week, and I knew she had a troublesome birth, but, her mom brought her in. I knew her grandma from another floor of the mouth training I did in Denver. And so they told me, she had all these cranial bone issues, and then she has this tenacity, and she's very tenacious in life. And she's like, I think, 14 years old. But so it basically, something came up in the appointment as I'm working with her, about 3 years old. She was mad, and it was because it was winter and it was cold. As soon as she said that out loud, the floor of her mouth loosened, and it got easier to lift her tongue. So the somatic emotional release is a huge part of my floor of the mouth protocol that I think a lot of people need, because sometimes the tension isn't coming from the body, it's coming from elsewhere. So I just really, because I was like, I want to see what's going to help people the most. Where can I look within a person? And so just exploring, like, where is this tension coming from, and how can we bring up things and find any relief from it, so that, in this case, that patient in the Bay Area, so we could help her release those emotions, but also so she could get a freer tongue so that she could loosen up those cranial bones. So maybe that feels like it's all over the place, but I think a lot of people are coming to me at this point because they want my work with the floor of the mouth, and they want airway or feeding help. But really, it started out as there's tension, and where else can it come from? And some people, when it comes down to it, they're coming in because their emotions are the root, and then we're also working on airway. So it's kind of this interesting thing of interconnectedness where the body is just so connected, and where can we use vantage places to look and see where the solutions are.
Do you find that certain areas of the body correspond with certain emotions or life experiences?
I definitely love and appreciate my Indian heritage and the Chinese medicine heritage, and then a lot of the other works that connect certain emotions to certain body parts. For me personally, I look at the nuance, and Crayola 24, Crayola 48, and then there's Crayola 500 and whatever. I don't know the number math.
Yeah.
I find when you look at enough colors, you'll find emotions attached to all different organs. And you'll find that, yes, while an angry person might have a gallbladder issue, that anger might land in the big toe too. So I don't personally feel like that is always the case. And for me, I feel like that there's just so much more. The body's so complex that I find that'll change from day to day with a person, and from person to person that could be totally different depending on where they've had pain or trauma, depending on that.
Okay. That's really interesting. I think that's a good thing to flesh out, because sometimes there is a major emphasis on different areas of the body connected to certain things.
There is, yeah. I mean, some people come in with trauma, they've had a car accident or something, and we'll work through that, and then they'll come in the next time and it's completely different.
That's fascinating. And coming back to the floor of the mouth, why do you feel why it is an area of the body that's often overlooked as far as being a major contributor to tension that can impact the ability to heal and release tension? Why do you think that has been overlooked and is such a vital area?
Yeah, and I think that I can owe great respect to Dr. Zaghi. There's others that have been in the field even longer that have been working on tongue ties. And then we can say like Barbara Green, who's a myofunctional therapist who's been doing that she's 83 years old. She's been doing it for like 50 years. So at least 50, 60 years long, some of these providers have been working with the floor of the mouth. A myofunctional therapist is more catered towards complex understanding of how the mouth and the airway works and guiding people in exercises. And then, of course, as a body worker, I'm getting in there to really investigate tension in the floor of the mouth and find out how to loosen it. And so there's a lot of people in the field that we could say, like, aside from the dentists who have done the releases and the body workers like osteopaths and chiropractors and craniosacral therapists and craniosacral fascial therapists and rolfers, and they've been working with this area. And so people have done it for longer than I have. What I think that I did was I just kept getting curious about what's going on when I release the floor of the mouth and all these other areas loosen, and then this one doesn't. Why does that not loosen? And then I started to figure out how to loosen that area. Then I would go up. So I think to cut that kind of like a verbal processing session short, I think I created a map built on data. And that map, my airway map, has these 70 points. And I think a lot of people care about it, and they thought about it, and they worked with it. And I am thankful because I was able to learn from them. And then I think, say, now let's create a map so we can go into these uncharted territories with a map to help guide us through to work, and very precisely and very systematically. And I think that's like the differentiation that I'm bringing, is not so much that nobody was doing it, just so much that I'm like, I feel like I was given a map. And if I'm given the map, I need to make sure I'm putting it out there, because I need to make sure that everybody who can get it can get it. And also, I know that like my Floor of the Mouth tour is, that is about practitioners learning how to do what I do. And I've had the great benefit of having people who are brilliant and expert healers come in, and I'm humbled that they're there to learn this protocol, because what they can do is they can take this protocol, put it inside their practice, and boom, you've got this thing they're already doing, and then it takes it to another level with getting their results even better. So I'm very thankful for that. And I think also we can't all as providers get to all the people, and all you people can't get to all of us. It's expensive and time consuming. And so I'm excited for your audience to get to learn about tongue press, because it's this course for anybody with a tongue, but it is about the floor of the mouth, and it is about how to loosen it. So I wanted to make something that was like anybody out there could watch and do at home and do for themselves or do for others in their family, including babies, infants, that could help out. And I feel like more than ever, when I have families coming in and I'm working with their babies for the floor of the mouth and helping with breastfeeding and tension relief and hypersensitive gag reflex and a bunch of those things. Well, yeah, I mean, I'm going to demo how the parents can work in the kids' mouths, the babies' mouths, but then I'm going to show the parents in their mouths, and inevitably we're going to find probably a tongue tie. And I've had the great fortune of being in the room with grandparents of the baby, and they have that same thing, tongue tie. And I've even had one or two families with great-grandparents where all of them did. And so I'm like, oh, man. So then they're like, all of us need to come to you. And I'm like, yes and no. Like, we could just have you all come, but let me teach you guys something, and let's do a video. And then after that, you guys do it. And I did so many of those videos. I mean, hundreds and hundreds and hundreds, that finally I'm like, I need to make one summary of it all, which is tongue press, on how people can just do this, even if they can't get access to me, or like you have like 15 people in the family and there's no way you can manage that, right? Time and money. So I do think like this is the year for me. It's a year for me of like sharing more about it, because I just think we're realizing so many of us have this need. So many of us have tension there. And if there's tension in the mouth and we release it, it's extraordinary what can happen with the whole body, and what relief we can find.
Can you give us some examples of how your floor of the mouth protocol has been that key to unlock progress in patients, especially those that you have implemented your protocol, remotely, because that's definitely something our listeners are going to be interested in, because like you said, this is something that is not widely accessible yet. I know you're on a mission to change that, to teach practitioners how to use it. So give us some examples of how you've seen it change patients' lives.
Yeah, one person from Romania, it was interesting. She had brought her 1.5-year-old in for work with the oral ties when she was in my city visiting. And then she traveled back to her home country, to Romania, and she reached out and she's like, hey, I'm struggling and I need some help. And she had the issues the whole time, but she was trying to focus on getting her son the help that he needed when she was in our city. So she's in Romania and saying, can we do anything? Can you help me? It's just like SOS messages via email that I was getting. Yeah. And I'm like, oh my gosh, yeah, let's schedule a virtual consult. And I kind of just started doing them at that time. And
what were some of the issues that the child was dealing with?
So in this case, this was for the mom, and she's like,
for the mom.
I think she was upper 40s, has 2 kids, and just horrible back pain, like the kind that would leave her debilitated and she'd have to crawl around. She was dealing with some of that. She had horrible sinus problems, horrible headaches, but she was just like she said, miserable. She was just like, I'm just miserable. I don't know what to do. I've gone to the physical therapist here. I've gone to the chiropractor. And she was getting some relief, but then it would just go away. And so that were the main things, the pain and the rigidity, and like she can't do anything, and it triggers this even more. So that led me to say, let's just get on there and see. And so when I evaluated her, and I did take some history, but I could see her lack of mobility. I led her through some range of motion stuff, but I could also just sense and feel her kidney was out of alignment, and had her push in, confirmed it. Yep, because she could see the tension was there on her right side under her last ribs. That's often where you check for kidney tension. And then I had her evaluate her mouth, her tongue, and I was like, oh yeah, you have a tongue tie, of course, because your son did too. And I'm like, you do, and that's part of this. So I had her do some movement with her tongue and mouth, and then work on her. I taught her how to release her kidney and
amazing.
Do a few other movements, and we did this in an hour session total, all of it. And I got emails back from her saying, like, oh my gosh, like I can feel some relief. Like I can actually, and in the moment she was feeling it, but it was another thing to see, like days later, weeks later, her saying, like, I can actually move without that excruciating pain. It's like way more manageable. I can breathe. Like from the pain, she was not able to breathe well because it was catching her breath, and she'd already tried all the powerful, strong stuff that she didn't ever want to take, and none of that was touching it either. So we did one more session, and it helped even more, and it was pretty dramatic. And then eventually, she's like, "I'm going to be visiting again." And she ended up moving to the city, Reading, for like 6 months so she could get some care and do some other things that she was excited to do. So we did have the ability to work way deeper and get her functionally stronger and more able to do way more, which I was really happy to be able to work with her. But, I've had other people with the same, with I'm only seeing them virtually, and we're seeing them like get better, get out of those places where there's just, they don't know what to do. They've tried things. They're just not able to. And for her, it was this right kidney that was the crux. Like once that right kidney released, the mouth loosened and her whole body got a lot freer. So it was more than just the kidney, but I think the kidney was the thing that needed to be released in order for the other areas to loosen.
That's just incredible. What a difference. And it's amazing this technique that you've developed can help even remotely. I mean, that's something really special, truly unique. And I know that will be hopeful for a lot of our listeners. And at the end of the podcast, we are going to talk a little bit. I'm going to tell you, more listeners, where you can find resources to learn from Dr. Bulchandani remotely. And then if you are in Santa Barbara or the Bay Area or LA or Phoenix, don't hesitate to reach out to him to see if that would be an opportunity to work with him. So talking about Airway, you've mentioned and talked about and explained really beautifully how this floor of the mouth work relieves that tension in the body, for babies, improves ability to feed. For, this adult patient, reduce that back pain, allowed her to function normally again. What have you seen as far as how it affects airway health? How you can take someone that's struggling to breathe well, that has symptoms of sleep disordered breathing at night, you're not getting enough oxygen, has a tongue tie, maybe hasn't had the opportunity to get it released, or maybe is really nervous, apprehensive about a release. How does this floor of mouth relate to airway more specifically?
Yeah, it's really kind of like this beautiful thing that happens. What sets in motion when the floor of the mouth loosens? Some people, and a lot of people, and then to differing degrees depending on what's going on. But when the floor of the mouth loosens, those muscles connect to so many places, like the hyoid bone, which is the throat bone. And the hyoid is often involved in airway constriction and airway issues. And because the floor of the mouth is the mylohyoid, and the hyoid muscle can loosen and get it back into a better alignment when the floor of the mouth loosens, sometimes that throat bone goes on its own. That's what I love to do, is before I do any, I don't want to call it tampering, but any like shifting and shoving and working on the body, of course, gently with babies and adults who don't want deep work. And then for adults who need deep work, we do that structural integration work. But it's like to free the tongue with the floor of the mouth movements, and it can set up this chain reaction of loosening the lip muscles, the cheek muscles, and the back of the palate goes from, so often in any of us that have that tongue tie, right, or the back of the palate's too low because the tongue hasn't been lifting it up through gestation and through early movements. So often people talk about the high and narrow arched palate. That's the maxilla. But we don't often talk enough about the palatine bones in the back. They're too low, depressed, right? So the back of the tongue, when we do the floor of the mouth release, it can go lift up and push those bones up a little more easily. What's cool is that before I even see that happen, before the patient goes out and comes back a day later, tells me, yeah, it's so much better. Instantly, when the floor of the mouth loosens, it sets this kind of chain reaction through the fascial system and through the blood and nerves and lymph to where the back of the palate on the right almost always instantly lifts on its own. It's like an instantaneous release, simultaneous. So the back of the palate lifting up, and you heard this phase, and some of you all out there might have or might not, but the roof of the mouth is the floor of the nose, right? And so the palate is the floor of the nose.
I love that phrase.
So often if this is going on with the back of the palate, then you're going to feel like rigid, soft palate or velum muscles. And then those do not allow the proper airway passage through the nostrils, and you have a restricted nostril airway, right? So often some people with just releasing the floor of the mouth gets the back of the palate to lift, the floor of the mouth loosens, also the soft palate muscles, and some people automatically can take in air more easily through their nostrils. And that is beautiful. And there's also this thing that happens when you drop the floor and then the head just goes mind blown, or more like freed up. So it expands the constricted cranial bones, and those tight head bones go and they become more expansive, and you have this cerebrospinal fluid blood flow that happens from the brain through the body and back up, that before that was just tight and rigid. And a lot of us are talking about nervous system regulation. Well, if that's all happening, all those areas are tight and jammed, well, good luck having nervous system regulation. Good luck being able to relax and ramp down and relax, just like you were talking about with relaxing and settling. And then if I can get nitty-gritty for just 1 minute here, The
Yeah.
nervous system is amazingly housed by the brainstem, the cranial bones, but the upper cervical, like occiput, C1, C2. A lot of people have been chiropractors or anybody. You're like used to getting those areas worked on. What I found with the floor of the mouth work, this is what made it crazy for me, is that before that point, I was, chiropractor for 8 years working on bodies, adjusting atlas, adjusting C2, adjusting occiput. Once I figured out how to thoroughly release the floor of the mouth, automatically the occiput released, C1 released, C2 released without me needing to adjust them. So there's so many people who come in and I adjusted them in the past way too much in those areas, or they're like, I'm probably going to need my C1 and or C2 adjust. I'm like, maybe. Once we get the floor of the mouth loosened, we go back and we can't find the misalignments. And then we check them the next time they're in. And I'm like, here's why. Because of that tongue tie, narrow arch, etc., from back in the womb, you had that issue and you grew up with that. And so when we keep adjusting that C2, we're just telling your body you need it more, and it doesn't even last. So when we get to the root and your body feels validated, understood, and heard, and it actually solves the anatomical problem of like, man, that tension was there because of the tongue tie, because of the floor of the mouth tension. And if we can release that floor of mouth tension and I can teach somebody how they can keep it loose through these exercises, then they can get that upper neck way more in alignment. And that's going to lead to, being able to regulate their nervous systems better, not being as like tense and not being as like prone to stress out and having more resilience. Of course, I'm a big fan of somatic therapy and, counseling, and these things are really necessary and all of that. But I think our bodies have a tremendous capacity to be supple and resilient if we find the access point. And so for me, the floor of the mouth just kind of stands out there as one of these areas that just does so much for us.
And just so our listeners understand, the occiput is the base of the skull.
Yes.
And C1, C2 are the very first bones in the spine. And it's interesting you say that because I did a release for a patient about 3 weeks ago, a 6-month-old, and it wasn't much. Like I've learned from Dr. Chelsea Pinto, who I just admire so much, and she is a complete expert in infants and toddlers, and that's the primary group that she treats. But it was so interesting because what was especially neat is the baby that I treated is the son of just a wonderful chiropractor here in the area. And she's just amazing, uses a lot of intuition in her work. And she said that she had to adjust that atlas, that upper spine, base of the skull, just routinely, a couple times a week. And he just always had tension. His back was arched. She said he never was really cuddly because he was so stiff. And we did that release, and it wasn't much. I learned from Dr. Pinto that as soon as we see that movement in the tongue, to stop. That's it. No more. We're not going for a certain look or deeper release, just a little bit. And she said she hasn't had to adjust his atlas since. And that it was the first time that he actually melted into her, just snuggling, and he started making more noises, and he just had a different look in his eyes. And of course he started feeding better. And it was really powerful feedback. So yeah, that's really interesting that you just mentioned that. His ears were more even as well, and his cranial bones were more even and aligned. So really fascinating. You talked to me about this before a little bit, and when I was just remarking, wow, this is so incredible, she's like, yeah, you know, this is all connected. I'm like, yeah, I totally understand that, but still, it's just mind-blowing that releasing tension in one area of the body can affect so much, so dramatically, so quickly. Is just really, really powerful. And I love that you're doing this, and especially that you've made it accessible. And so if there's any providers listening who want to collaborate better with other professionals, learn more about this floor of mouth magic that you're doing, what's one simple way they can really open that door to be able to provide this relief to patients.
Yeah, I mean, there's definitely, well, I have a podcast called Compromised to Alchemized, and on there
Really good podcast.
Yeah. And I
Even
talk with
if
a
you're
lot.
not a
You're on
provider.
there, right? Craig, Dr. Clayton's been on there, and well, there's a lot of things that I'll say, and there's tons of keys that I'll give out there. Or if you Google, on so many podcasts that I've been on, that I talk about the keys and how you can find ways in. But I think the main point is like, just explore. Take time. I think time is sometimes the most wonderful friend to curiosity. And so if you partner time with curiosity and you put that with a care and intent towards what you're trying to arrive at with someone, you'll find gold. But come on over to my, I've got a Floor of the Mouth online course, totally awesome course. That's always there. You can do that. But I mean, if anybody's around, by the time this goes out, I mean, people could come to my 2-day training for the Floor of the Mouth in Phoenix. It's in June, and then July is Boise, and then I'll be in Chicago in August, possibly Minnesota in September. So come out and get, and then we're doing some awesome things there where you just get way more kind of immersed in it. But shoot me a message on Instagram at Dr. Neel Bulchandani. I've got, a lot of good videos, content, reels, whatever. So just reach out too if you want to know more.
Thank you so much. And to all of our listeners here that are not practitioners, or even if you are, Dr. Bulchandani has graciously offered a discount to his mini course for our listeners. So you can snag the tongue press mini course for $70 off. It's normally a $90 course. This is extremely, extremely generous. So thank you so much. And so it's just $20.
Yeah.
And you've heard from him how impactful it is. So the code is DISRUPT20, and that is just the number 20, and that will be in the show notes. And to conclude, what's one mindset shift you'd offer to someone at the beginning of this journey, especially someone scared, overwhelmed, but ready to feel better?
Yeah, I think that some of you are so good at doing this, but I just, for whatever reason, I hear these words, be supple. And, maybe Bruce Lee was big at saying that when he was talking about his martial art and how you can be really powerful, really fast. And I think, for me, healing can come that quickly. You could go from compromised to alchemized, and sometimes it's a messy, long journey, and we know that. But sometimes all it takes is that hope towards another day, another sunrise. And if we can be supple and malleable, like not get down on yourself for what you did or didn't do, and not negate your worth, your self-worth, and all the amazing things that you have done, I think if we can just validate how much you've done and how, even though you might feel like you're in a tough place, or if you were in a tough place, you know what this feels like, bend and be supple with these hard moments, because you won't break and you'll last and remain. And then when you get to this place of where things begin to become a little easier around you, you'll flow with that. And so be supple, be resilient, lean it on others for the help that you need. I think the village concept is just the truth. We need a village. We need people we can rely on. And if you aren't relying on somebody, find somebody you can trust that feels safe for you, and lean on them, because then we're going to automatically feel more relief.
What a beautiful message. Thank you. That's such a wonderful way to really summarize and give people hope. So thank you so much. It has been just an absolute pleasure talking with you today. And I want to remind listeners that his podcast is From Compromised to Alchemized. You can get that wherever you get your podcast, Spotify, Apple Music. You can also find him, Dr. Neel Bulchandani, on Instagram. We'll link everything but in the show notes below, so you can easily access it, as well as the code. So take advantage of this. Take advantage. $20 for just a wonderful, life-changing course. So please take advantage of that. Again, if you are a provider, that online course is there for you, and also consider coming out to one of those in-person 2-day training. And it truly is just life-changing, these things that you've developed. And again, Dr. Neel Bulchandani is just he's a very special person. He knows how to really tune into people's bodies, their energies, to most effectively help them. So thank you again for taking the time to be here, and I'm sure we are going to talk again in the future.
Yeah, you're so welcome, and thanks for having me, Dr. Clayton. Thanks for your interviewing and for your doing for the field to do these tongue-tie releases and seeing that wonderful result with having the chiropractor be able to feel like what changed. And like, it's amazing you're doing these and also putting your info out there. You're helping so many. So what a privilege to be on here with you and just getting to hang out. I loved it.
Yeah, it was so great. Well, thank you again. And until next time, listeners, I hope you take care, and we'll see you on the next episode of Dentistry Disrupted.